Good evening. My name is John McCalley. I'm the director of the Iowa Department of Elder Affairs. I will not take the lead that my colleagues presented. Since two legislators didn't show up, and there's 8 extra minutes, and everybody ended more quickly than they should have, and you have an Irishman batting swing cleanup, I'm going to take all the rest of the time. Oh, seriously. Thank you, Di, for the invitation to be here. It's my pleasure and honor to present before you. Thank you for all of the work that you do. If you're a direct care worker, you touch everybody's life in this state, and mine in particular as well. I wanted to make a few brief points, and some of them are in keeping with the conversation that you had with the previous panel, and some of them are a little bit more formal with regard to the work that the executive branch does in the Culver administration. But if you leave with no other impression from this panel tonight, leave with the strong impression that Governor Chet Culver, Lieutenant Governor Patty Judge are squarely in your corner as advocates for your cause. And I hope to present you with a little set of tidbits as evidence. Bruce Keppel at AARP mentioned that there's a need to address healthcare reform and the direct care worker issue through federal legislation, and I couldn't agree more. There needs to be a federal solution, and I urge you, if you haven't, to start contacting your federal legislators and ask them to get the train moving on federal health care reform. I know for a fact that there's a lot of energy going on behind the scenes in the Senate around Senator Baucus's principles on health care reform, and if you have an opportunity, the Senate Finance Committee Chair has that online, and it includes references to trying to address the problem of healthcare worker shortages in the United States. Not that that will necessarily be the engine that drives the entire legislative forum, but as chair of the Finance Committee, he has the opportunity to set the tone. For recruitment and training and retention, I'd like for you to consider what Iowa has done as a good first step toward a model for the country, and in part is evidenced by the work that the Department of Public Health is doing, the Department of Inspections and Appeals and Human Services and DEA, but also the response that the General Assembly is starting to have. It's because of the awareness and advocacy and the fact that you started pushing and never stopped pushing. So keep pushing. At DEA, the Department of Elder Affairs, we have focused on direct care worker issues from a couple of different angles in my tenure in this job. And I'd like to start first with describing to you the work that we do to lead the Senior Living Coordinating Unit. This is a body, a multi-agency body with two consumers that meets quarterly and discusses a variety of health and long-term care issues from a public policy standpoint. And a few years back, it developed a long-range plan for long-term care in the state of Iowa. And that long-range plan contains a set of recommendations on how to improve issues related to recruitment, training, and retention of direct care workers in Iowa. But we never formalized recommendations to the General Assembly. So this year, all of us met and developed 12 recommendations to the General Assembly, not the least of which four focus solely on direct care worker issues. I'd like to read you one of them. In the section on access, the recommendation number 5, we strongly recommend that the legislature should pass a caregiver and direct care worker support bill that recognizes the importance of caregivers and direct care workers and considers A, tax incentives and tax credits for caregivers and direct care workers, B, provides for an annual cost of living provider rate increase, C, establishes a forgivable loan program for professionals who stay in Iowa, and D, establishes a GI bill for health and long-term care workers. There's 4 other recommendations that follow in the same theme. But those recommendations were forwarded on to the General Assembly. I hope that through your advocacy, through the combined partnerships with organizations outside of the Direct Care Worker Iowa Caregivers Association, and I know Amos is here, that you generate legislation around those recommendations and carry that ball a little bit farther. The Department of Elder Affairs also chaired a task force on Alzheimer's disease in 2007 at the direction of the General Assembly. And we came up with 22 recommendations on 4 major subject areas. On direct care workers and education was the #1 subject area of focus. And as a result of the recommendations that came out of that task force, the General Assembly passed last year Senate File 2341, which establishes for the first time standards and code for direct care workers, family caregivers, and workers who relate on a regular basis to people with dementia. The progress report on that is that we have put out an RFP for that program with the limited amount of funds that we have in the department. The University of Iowa has won that RFP, and they are working right now on phase 1, which is the development of the modules, the training modules. And once an outline is available, then we are charged with coordinating that with the Direct Care Worker Task Force as mandated by law for getting feedback and so forth. And phase 2, which is next year, is coming up with a plan for then rolling out the implementation of these training standards. So there are concrete steps being taken, not only through task forces and recommendations, but actual provisions, new provisions in the code, and new, hopefully, dedication of funds as we move through the advocacy. The next step is, from my point of view, is expanding the advocacy and protecting, frankly, in tough budget times, the programs and services and steps that we've taken in the past. Just because there are budget problems doesn't mean that you have to take no for an answer. You must keep asking and asking. So I leave you with one last call. Please keep pushing and let me know what I can do to help. Thank you.